We have talked about on this show so many times about menopause and about HRT, and we would normally bring Dr. Caoimhe Hartley on to have a chat, and we'd take questions for her because, of course, we care and we want men to understand what women go through when they go through the menopause. Because it can be quite difficult. And the reason women go through a menopause is quite simply because at that point in their life, at 46 or 47 years of age, or whatever the average age happens to be, or your age happens to be, for some women it can be younger, some can be older, your hormone levels decrease. They change. Your estrogen level drops, your testosterone level drops because you're a female and you have about 10% of what a male would have. And all of the time we think, there you go, that's something that affects women. We never, ever think about men when it comes to this. Now, I'm not suggesting men go through a menopause, but it's called an andropause, as far as I know, that men go through. And we have covered, as I said, menopause for women many times. So we decided we would do something similar because somebody mentioned it on the show last week. Why don't we talk about it? So I said, OK, we will. Men go through hormone changes in life as well. And as men age, their testosterone levels get lower. And low levels of testosterone have been linked to certain health problems, which include weakened bones, diabetes, heart disease. And there are symptoms that we can look out for. And we're going to talk about that. To tell us a little bit more about it is Dr. Emmet Byrne, who joins us. Good afternoon to you, Emmet.
How are you? Thanks for having me.
It's something we don't really... We hear conversations constantly about menopause, and then somebody said to us one day in the air while we were talking about it, do we never talk about men and the same problems that they have? It is kind of similar to some degree, although we're kind of limited to just one hormone mainly, really, aren't we?
Well, it's one that stands out more significant than all the other ones, but hormones work in an interactive basis, meaning that if you affect one, you're going to affect them all. So it's the one that people tend to identify, obviously, and men themselves, with being obviously male, because it's what impacts male characteristics and what essentially really makes us men, giving, obviously deep voice, hair growth. These are the androgenic effects, and then the anabolic effects are things like your physical differentials from women, such as kind of bigger muscles and things like this. So maybe even things like sex drive and more aggressive kind of tendencies and stuff like that. Not that it's just these are the characteristics that tend to be associated with being male.
Okay, so we start producing testosterone, I assume, at puberty, which is around the age of 11 or 12 years of age. Or are we producing it from the day we're born?
Oh, no, from when we're born, yeah. So even before we're born, we get two main kind of, I suppose, big spikes in testosterone, and the one is just before we're born, when we're born. This is for men specifically now, and it's slightly different, girls slightly different. And then both get it at puberty as well. So there's two main spikes, very early.
So that's why your kind of voice breaks and you start to grow a silly Ronnie under your nose and all that kind of stuff in around the age of 13, 14 and 15.
Exactly.
And then some men overproduce testosterone, hence the reason that we have dihydrotestosterone, which makes men's hair fall out as well, so they get premature baldness as well.
Yeah, it's slightly different. There's a testosterone converts in the body to different things depending on it's a genetic differential. You have a thing called aromatase, which converts to estrogen, but you also have a pathway which converts into a thing dihydrotestosterone, which combines to a hair follicle, and that makes it fall out. And not everyone's prone to that, hence we get some people that obviously have male pattern baldness and others that wouldn't. Yeah.
Okay. So, by the way, just on that note, the old adage that, bald men are sexier, does that come, I suppose, from this idea that you lose your hair if you produce loads and loads of testosterone? Probably, to some degree.
You mean you're associating with being more manly?
Well, isn't that what they say? The bald men are sexier or something? I don't know.
Yeah, I'm not sure. I mean, that's I haven't explored the social side of the impact.
Okay, so
the philosophical side of testosterone, but it's quite possible. Yeah.
Okay, so at what point does our testosterone levels? Because we know that men, produce, compared to women only have about 10% of the testosterone we have. At what point in our lives does our testosterone levels, the production of testosterone, start to fade away?
So it's a good question. Okay, so the differential, obviously, the clear distinction between men and women women go through the menopause, which obviously is a binary cutoff of their ovaries functioning. They get testosterone from two areas mainly. One is the ovaries themselves, and then the adrenal glands. Whereas men primarily small amount from the adrenals, but mainly from the testicles, the testes. But the thing is that there's no binary cutoff there. So there's more of a kind of gradual decline over time. We call it late onset hypogonadism. Hypogonadism is simply just the inability or the suppression of testosterone.
So we only produce it from our testicles. I didn't know that. I thought we produced it from some other gland somewhere else as well.
Oh no, the adrenals produce a small percentage of it as well.
Okay,
the majority is coming from the testes in men. It's a bit more divided with women. Yeah, there's other tissues that produce it as well, but it's mainly the testes in men. So that's where they're going to feel it if there's a decline there.
Okay.
And go on, yeah.
So at what age should we start, or do we normally see the symptoms of decline then when it comes to, I suppose, the lower production of testosterone or the gradual decline of it?
So they say that, again, there is research done around this, and there's talk about 20 to 39% of men aged between 40 and 79 years of age have, some level of testosterone deficiency, loss of testosterone, oppression of testosterone, or whatever you want to call it. And then over 79, then that goes up to anything up to 50% plus. Now, again, these are studies, that are done, not probably on a large enough population to really verify this, but in my own experiences, just from people coming in talking about it and stuff, you're talking really in mid-40s, you're talking probably on average in terms of age, of guys who notice this slowing down of things, and then they relate the symptoms back to testosterone deficiency and at least get it investigated. Now, there's a very strong correlation with poor lifestyle and the loss of or interruption of hormones in general. Now, we know that from diabetes. Like, obviously, type 2 diabetes is as much an environmental driven disease as it is a genetic one. So, for example, what you do on a day-to-day basis will impact the progression or in terms of slowing down the exposure.
So things like your diet, do you smoke, all those other things as well?
100%.
Absolutely.
Yeah, 100%. So if you're overweight, if you have type 2 diabetes, if you're sedentary, anything like this is definitely going to have an impact on your testosterone levels. And we know that, like, say, for example, resistance training and stuff like this increases, like obviously done in a sensible way, increases your testosterone levels. So you can maintain it as you get older to a certain point. Obviously, age is the best predictor of any disease, yeah. But it will, but you don't necessarily need testosterone replacement as you get older, but some guys will in some cases have a slight genetic predisposition, and irrespective of what they do, they'll need it, or they'll obviously have symptoms of testosterone deficiency if they
okay, so testosterone deficiency, so you're saying, well, according to one of the studies you mentioned, up to 30% between the age of 40 and 74. So how do they know? So if a guy is a little bit concerned and go, oh well, I wonder, is that me? Maybe I'm feeling a bit tired lately, or a bit irritable lately, or I've maybe a decrease in muscle mass or whatever. So are these the kind of first symptoms, or is erectile dysfunction a first symptom, or what are the first symptoms that you should notice if you think your hormone levels are a bit low?
Okay, so the most common symptoms are, and the ones that tend to lead early are the sexual ones, I'll just go broadly. The symptoms that you'll feel are divided between physical, psychological, and sexual. Okay, so the ones that are most common tend to be erectile dysfunction and reduced libido, certainly desire for sex. That's the most common presentation, but it can fall over a combination. Usually is when guys have that, they will have certainly a loss of strength and recovery from, say, if they were doing training in the gym, they'll have a loss of muscle, they'll have an increased, say, central adiposity, meaning they'll have a little bit more girth around the waist. And then, one that's very common, I find, that correlates very strongly as well, is levels of anxiety going up, the ability, slight mood drops, but certainly anxiety, ability to cope with things gone down.
Sounds very like the menopause for women, actually, doesn't it? When you look at it that point. I'm not trying to liken it too much, otherwise I get complaints. Lots of complaints from my female listeners saying, "Don't you dare even try and do that." But the symptoms are very similar, I suppose.
Yeah, and fatigue is the other one. Like, so, typical guy who would have been quite energized, say, is highly productive during the day, and then maybe falling asleep on a chair at 7 o'clock in the evening, like without real reason for it.
Okay.
So fatigue is being able to push,
and lack of focus, I suppose, would go with that too, or concentration levels and all that would go with the tiredness.
Right. Yeah. Absolutely.
Okay, so let's say you're 50 years of age, you're concerned, you're listening to the radio now, and you're going, "Geez, that's me. I'm not in the mood for it anymore. I can't get an erection anymore, and I'm feeling tired all the time. I'm only 50. What should I be doing about it?" What can you do about it?
Okay, so the thing is, if you have these symptoms, so people who should be screened fundamentally are people that have obviously symptoms like this. Now, the problem, I have to be very clear, there are other causes of these symptoms as well. So you have to be, I would suggest you getting them checked out, but it'd be wise, I'd say, to get a testosterone check, okay, which is simply a blood test. So you have symptoms like what we're talking about. You go to your local GP, you talk to the GP about the symptoms. Now, they'll have to consider other things, but it's a simple blood test to get a total testosterone blood level check, okay?
Okay.
And then that will give you a certain number, and then the GP then will be guided by this number.
And are these tests similar to the one, I'm sorry for interrupting you, Emmet, but
no.
when women have the test, say, for menopause, they say sometimes these tests are not very accurate, because we were talking to Caoimhe Hartley about this a while ago, who specialises. She said because it depends on the time of the day when the blood test is taken. It depends on the time of the month. It depends on, well, women obviously the time of the month. But certainly, different times during the day our levels go up and down, I imagine.
Yeah, it's not as fluctuant as women, but it is fluctuant. And generally what we do is we take a fasted sample between, say, any time in the morning up to about 10 o'clock, 11 o'clock in the morning, and we do it twice, just to be certain. Now, it's a little bit more complicated than just taking a total testosterone. So say you have some of the symptoms, you take a level, and we work off certain, like kind of obviously, below certain thresholds. So if you're below a certain level, we have to extrapolate the free testosterone, which is the active hormone in the blood, from the total, which there's a protein in the blood called sex hormone binding globulin, which goes up as we get older. That binds onto testosterone and makes it useless, makes it inert. So we have to calculate that as well, so we can look at the free testosterone, and that's what correlates with symptoms. If that's below a certain level, then we look at lifestyle, we look at all the other things that will affect testosterone levels. Obviously, we want to straighten those out, and then if they're all done and the levels aren't going up, then we're likely to treat them. That's the way we will do it.
So you're going to treat somebody, let's say, and you figure they're below the marker that they should be. And, you've looked at everything. They lead a reasonably healthy lifestyle, as much as can be expected at 50 years of age. So then what is the treatment?
So the treatment is very straightforward. There's 2 licensed products in Ireland. Now, we have to be, obviously, the benefit, obviously, of coming to a doctor with all this is that you get monitored as well. We need to be very safe around this. So we assess for anything that might be, say, a contraindication for testosterone, which can be a raised PSA level. This is the sort of thing that would be commonly understood by GPs, but like any risk of testosterone is kind of, it's like the HRT for women in that there's a big fear around, obviously, breast cancer, endometrial cancer with women for HRT, but with men it's about prostate cancer, and it's an exaggerated. Testosterone does not directly drive prostate disease, but you still need to be careful around it. So
and the same goes. I want to make that abundantly clear when it comes to HRT, that the risk is minute.
It's minute.
But also people always need to be aware of it. And I'm assuming what you're saying to me is if somebody was predisposed to prostate cancer, taking a lot of testosterone wouldn't help.
Well, we don't expose them to it just in case, and there's a few pathways we can do. And now there is research going around where there's specialists, particularly in the US, that are researching around prostate cancer and the exposure to as in taking testosterone, and they're getting some very promising results. But again, this is all in the pipeline, so it's not finalized in relation to, from the point of view of practice. So we have to just wait and see what happens there. So we're very careful around that. But cardiovascular disease is another area where we have to be watching things that we have to be careful. We watch certain, like the thickness of the blood. We'll watch the PSA levels. We'll make sure the contraindications from the point of view of, for men, it's generally obstructive sleep apnea, cardiac heart failure, which is the inability of the heart to pump correctly. Okay, so we assess for this. One big one is that if you take testosterone over an extended period of time, it's going to affect your sperm count, and that's very, very important for people who want to have families. And obviously, if their families aren't complete, we have to obviously take that into consideration as well.
But I would imagine the majority of patients who would be taking a supplement or a hormone supplement like testosterone would be over the age, probably, of having families. Probably at that point, would they?
More often than not.
Yeah.
More often.
Okay. So these, I'm assuming these are gels similar to women. The ones they give to women. Well, the one they give to women is actually for men anyway. So I'm assuming it's a gel, and is there tablet form as well they can take?
Yeah, the tablet form really is discontinued. Really, it's not used that much. See, the reason is originally the tablet form was useless, and then they modified the tablet form to become useful, but it was quite toxic to the liver, so they changed that. Now there is a new one in the States that's come out that has been licensed, but it's not here yet. So the 2 main forms here are transdermal gel, which is the same as the women. So you rub it onto the shoulders. You've got to be careful of cross transfer there. Okay, that means that if it's on your hands and you're touching like pregnant women or children for that matter, you can transfer it across. So there has to be there's caution around that. But generally speaking, it's that's one form, and that is a short-acting form of testosterone, meaning that you take it every day. Okay, and then there's a longer-acting one, which is the other licensed product, which is an intramuscular injection, which is once every 10 to 14 weeks. And that just basically means that it's a very slow-acting. You go in, it goes into the system, and its half-life is longer, meaning that it'll have an effect on the therapeutic effect on the body for an extended period of time, and then you just basically get another one every 10 to 14 weeks, depending.
And the success rate when you're getting, say, a supplement of testosterone like that or additional testosterone, does that normally remedy the problem then, and people find that they've had a new lease of life?
Absolutely, yeah. I've seen it. Yeah. It isn't like, in most cases, I've seen it where it doesn't, but it's extremely rare. Most of the time it's night and day. So in
other words, these guys that have seen this kind of feeling tired and irritable and erection problems and lack of sexual desire, suddenly all of a sudden their life is back to where it should be.
It is, yeah, absolutely. It is back to where it should be.
And so why is it why do we not talk about it, Emmet? I mean, this is the first conversation I've had in 12 years on the radio about, kind of, they call it andropause, I think, for men as well, similar to menopause. But why do we not have the conversation? Is it because lads don't talk about stuff like this?
Yeah, I think it's becoming more common. I just know because of Charles and me and people, obviously the interest in it. Generally, it's popular culture that's driving it. Like people like Joe Rogan and guys. These are people who now we live in a smaller world now, and the people are on on podcasts, and they're I suppose you say cherry picking what they want to see, and then they're looking. They might have symptoms of this. They might look it up. Then of course they get sidelined down an avenue where they're looking at podcasts and they're listening to guys talking about it who've been on the treatment and stuff like this. Now, it is stigmatized through, obviously the bodybuilding community and, other things like this might have created a stigma around it in a sense. Not that I'm being judgmental against bodybuilding, but stuff like that. But we know that it is used for aesthetic purposes, testosterone, in terms of building muscle and stuff, which can have negative effects as well. So it's
somebody texts in and says, "I've got too much testosterone. Can I get some taken away?"
Yeah, exactly. So the reverse. But it's the other thing I'd say is that there's a fear around it in the medical community not because it's warranted essentially, but because there's not a specific training pathway in relation to this type of medicine. So it's quite, I suppose, it flies under the radar. And then when people don't understand it or haven't been taught around it or its effects or are looking for the deficiency, then it can be just a little bit misunderstood and exactly.
Somebody else wants to know, is there natural supplements that you can get in your normal health food shops that can encourage the production of testosterone?
Yeah, there are. I mean, there's ones that there's ones that increase the adrenal to the thing called DHEA, dehydroepiandrosterone, which is it stimulates it's on the when you're producing hormones. All hormones start with cholesterol, broken down into a thing called pregnenolone, and then there's a big pathway where it divides up into different ways. You need certain precursors to testosterone to make it. Okay, so if you don't have any fat or cholesterol in your blood, you're not going to be able to make it. That's the starting point. But there are other ones along the way. If you're short on DHEA from the adrenals, then you can't make it. So sometimes you can take that. There's a thing called tribulus terrestris, and there are other ones that they're in relation to late onset hypogonadism, though, as in with slightly older guys, it's not going to work and make a significant difference.
Is it an interesting text here that I've just seen? And I don't know if this person is just taking the wee or genuine, but it does seem genuine enough. I've read online now that using testosterone directly onto the penis can encourage growth. I sadly have what they call a micro penis, and it has embarrassed me for years. Can you ask the doctor if it would actually help? Is that actually a thing?
No, it's not. No. I'm sure if it was, everyone would be doing it, I suppose. No.
Right.
Thanks to the penis. What you can do, I will say this in all seriousness, though, if the penis, and this is slightly, not on point, but for men in general, if you don't have morning erections, which is affected by testosterone deficiency, there's not enough oxygen getting to the tissues of the penis, and it can damage and fibrose the actual what we'd say the working cells of the penis, which means that you can actually shorten the penis because you're losing tissue there. Okay, so if you're not getting the morning erections, irrespective of whether it's testosterone or not, you can affect the penile length and the penile ability to get erect. So it is important from that perspective. But rubbing testosterone directly onto it won't make like in terms of length and all that. It won't increase it. Let's put it that way.
Somebody wants to know. They say something about orange juice, apple juice, fresh orange juice. I'm assuming they're telling us this is good for your testosterone. I don't know whether it is or not. And somebody else says, now, can you buy testosterone over the counter? I'm assuming you can't, Emmet.
No.
It's a controlled substance, I imagine. I imagine, by the way, there are side effects. I know the side effects for women take testosterone during menopause can be growing facial hair and a deepening voice. That's not something that would generally concern a man. But are there other dangerous side effects to taking testosterone? For men, I'm talking about.
No short. So super physiological levels of testosterone, i.e., bodybuilding levels, have side effects. No question about that. They're not. There's very few. I haven't heard of anyone dropping in a serious sense, like having a serious event from taking testosterone in the short term. And there's no evidence to support any of that. Exposure to high levels, as in levels that are above what's normal for a male, can have an effect on your cholesterol levels, can have an effect on your blood pressure, and can have an effect on your certain other parts of the body that can actually leave you more predisposed to things like vascular and heart disease down the line. We're talking decade plus after. So if you're exposed with high levels over an extended period of time, but the reverse holds true. If you're very low in testosterone, below the level, your risk for vascular disease goes up as well. So having testosterone in the sweet spot is important. Now, side effects, dangerous sudden onset side effects, nil. Okay. Side effects from it though do exist. You'll get testicular shrinkage. Okay, so you don't produce your own internal precursor to testosterone. The testosterone works off a feedback loop in the brain. Okay, so it starts with the brain. The signal goes from a part of the brain called the hypothalamus. It releases a chemical called GnRH, or gonadotropin releasing hormone, that triggers a gland called the pituitary, which in turn releases two chemicals, luteinizing hormone and follicular stimulating hormone. Luteinizing hormone goes down to cells in the testes, and these things called Leydig cells, and produces the testosterone. But testosterone levels rise, and then it switches off the signal in the brain so you don't have too much. And then when the levels drop, then the signal kicks in again. And that's your feedback loop. When you're taking it from the outside, you're injecting it, or you're taking it out.
I tell you, isn't the human body such an amazing thing, actually? We couldn't build a computer as clever as this, by the way. Another person says, what about people taking the test they get from their gym buddies? Okay, well, I wouldn't advise you take anything given to you by your gym buddies, because I'm assuming these are illegal products, which are probably still on the market, illegal products where people are taking anabolic steroids.
All that, yeah. So that's your super physiological, generally speaking, although it's getting more common now that the testosterone replacement therapy, which is within what we, prescribe and stuff like that, is becoming accessible online and stuff in what we'd call technically in the legal sense. So the problem there is monitoring, and then the other thing is the quality of the product. So when you're getting pharmaceutical grades, it's properly licensed, it's regulated, there's all those things around it, then you're putting yourself when you take any medication, it is always going to be consequences to taking anything. Okay, so you've got to reduce your exposure to the risk.
Well, the benefits must outweigh the risk, otherwise it just isn't worth it.
The benefits do outweigh a lot of the time, but there's short-term gain, long-term pain as well. We need to, if you're going down this road, particularly, I'm not talking in a bodybuilding sense, I'm talking about from...
in relation to that then, so if you're on Testosterone, which I'm assuming is what we're talking about here, and you're taking that on a daily basis as a man, is that, when you say short-term, can they continue? Do they have to continue to take it for the rest of their lives, or is that the case, or do they only take it for a kind of 6-month period, or how does that work?
Okay, so if a man is genuinely hypogonadal, meaning he's below testosterone levels, and you've done everything you can from a lifestyle perspective, you've looked at potential things like medication interactions and stuff that might lower testosterone, and you've dealt with all those issues, and they still need testosterone. To relieve the symptoms and reduce exposure to things like long-term cardiovascular disease and all the other things you mentioned, it is best to go on the testosterone. Like, you make that decision, it's a patient-doctor decision, and then you go on it. It's on it for life. Now, if you come off it, the consequences are not like tragic. You
just go back to where you were.
You go back to where you were, exactly. Yeah. But your risk goes back to where it was as well. So it's a decision. But so generally, when you go on it, it's an acknowledgement that you're going to go on this for like a long time.
Okay. Somebody wants to know: is it expensive, or is it available on the medical card? I don't know. Is it expensive?
Yeah, well, it's available. It's on the drug repayment scheme. So if you're on it, you're going to pay anything up to €80 for it. So you can apply for it on that basis.
Right.
If
Is that €80 a shot? Like, how long does that last?
It is. So the shot will last, 10 weeks minimum at least. So
Okay.
you're talking at most €80
Okay.
every 10 weeks.
It's expensive enough.
Similar. It can be, yeah.
Yeah.
But, yeah. And you're looking at like the idea of coming to, like, you need to be monitored as well. We monitor 3, 6, and 12 monthly initially anyway. So, and obviously when you're getting bloods done, and you're going to be, unless you're on a medical card, be paying for that as well. So it can be expensive, but generally speaking, when people are, hypogonadal, they feel so. Just each day is such a drag that when they go on it, they just feel so good. It's generally, as I say, the benefits well outweigh the negatives. Really do.
One final text. Somebody wants to know, how can I tell the difference between my husband, who may be low on testosterone, or just a lazy lump? You don't even have to answer that one, to be honest with you.
Well, the way I can answer that is, without being there, is that is if there's a sudden change relatively. Now, I don't mean a sudden change in, like, so if you had a guy who was working and he was he had a certain lifestyle and he was on top of things for years and years and years, and then over the last 2 to 3 years, this has changed, and in a relatively. So look at the previous baseline, and then if it's way off that baseline,
yeah, he's fallen asleep in the afternoon and all that kind of stuff. Yeah,
all that stuff. But
yeah.
also, but from a laziness, like from an energy point of view. Like if someone was very industrious between up to the age of 40, and then at 45 they can't get out of their own way, then you have to look at what their baseline was and go, well, there could be something really going on here, versus somebody who hasn't been very proactive all their life and then just doesn't change, it just slows down. So that's the difference.
Okay, so there's one here. I could read out all these questions all day. Can you ask the doctor, I have type 2 diabetes and high blood pressure, because of it, will taking testosterone help? I don't.
Very good. This is where I'm really interested, okay? So when you've got comorbidities such as metabolic, like that's the metabolic disorder, type 2 diabetes, you're far more likely to have deficient in testosterone or obesity, anything like this. People who I screen and I go after like really hard are people who have obviously a collection of the symptoms and presented with it, but also anyone with type 2 diabetes, anyone with a waistline over 102 centimeters, like in terms of weight, or anyone with like vascular disease, any comorbidity that they've been diagnosed with, you should have your testosterone checked, definitely.
Okay.
Because
so the answer to the question is yes, it may help. Indeed.
Absolutely, yeah. And there was research done in Australia, which I won't go into the absolute detail, but they've shown that the risk of diabetes goes up with low testosterone, as well as things like osteoporosis, anemia, and things you mentioned. But the problem is that if you're the effect of when you take testosterone has been shown to have the same effect as the leading medication we use for diabetes, metformin, which is the kind of one of the first line medications we use. It has the same effect on glucose metabolism in terms of improving your diabetes. So it's very potent in terms of reversing it. Yeah.
Well, I have to say, Emmet, it's been a really interesting conversation. I'm sure many people who haven't heard a conversation around that before are quite interested, and particularly men. Maybe wives, by the way, for their husbands. You can send them along now. And somebody, by the way, finally, somebody just wants to know, how can I get an appointment with Emmet? He seems to know his stuff. Because the problem is, the same with women, going to your standard GP when you have menopause sometimes isn't good enough. You have to go to one who specialises in menopause. Yeah. I know you specialise in men's health. I think your place is out in Bray somewhere, in County Wicklow. Right, yeah. Okay, yeah. So are you on a website or something that people can contact you?
Testosterone.ie. Go get us.
Testosterone.ie. All right.
Yeah, wouldn't be simple.
Thank you very much indeed, Emmet, and I really appreciate you coming on the air.
Thanks very much. No problem at all. Thanks.
Lots of questions answered there, I have to say, for lots of men listening. Testosterone.ie if you want to go online and have a look as well there. Okay, keep texting, keep WhatsApping your questions.